Tērana tātou katoa. Last month, I announced that our country would reopen our air border from the 13th of January next year. That decision was based on a range of high-level advice from the government's Border Easement Task Force and data modelling experts in New Zealand. I said at the time that this reopening would allow for two-way quarantine-free travel from New Zealand and that there would be an eligibility criteria for travellers, which would include requiring them to be double vaccinated and also providing a negative test prior to travel. Today I'm able to tell you about the Cook Islands COVID-19 Safe Framework that was approved by our Cabinet last week. These are the rules by which people will be able to enter the Cook Islands once the border is reopened in mid-January. This framework will be enforceable under new regulations available to Te Marae Ora. Under the SAFE framework, there will be 3 different groups of visitors able to enter the country. Each group will need to comply with its own particular set of rules. The 3 groups are tourists, permit holders, and Cook Islanders, or PRs. All 3 groups must complete the TMO online form 96 hours before departure. They must return a negative PCR COVID test taken within 48 hours of departure, and they must have been in New Zealand for at least 10 days prior to entry into the Cook Islands. In addition to the above, Group 1, the tourists, may only enter the country if they are fully vaccinated. There are no exceptions to this requirement. Consequently, children under 12 years of age will not be able to enter the country unless and until they are vaccinated. Those in Group 2, permit holders for work or residence, may enter the country if they are vaccinated. There are 2 exceptions to the vaccination requirement. Firstly, for children aged under 12, and secondly, for those over 12 who cannot be vaccinated because of a medical exemption. Those permitted entry under this exemption will be subject to certain additional public health controls upon their arrival into the country. For example, they will be required to self-isolate at home for 5 days and undertake COVID tests. Cook Islanders and Cook Islands permanent residents comprise Group 3. Group 3 may enter the country regardless of their vaccination status. However, those who are unvaccinated will be subject to certain additional public health controls upon arrival into the country. For example, Group 3 travellers aged 12 and over who are not vaccinated and do not have a medical exemption must undergo 10 days in managed isolation and quarantine at their own cost and undertake 3 tests during that time. If a minor aged 12 to 17 in this group is travelling unaccompanied, a caregiver or guardian will have to enter quarantine with them, and that cost will also be need to pay for. Group 3 travellers who have a medical exemption from vaccination must isolate at home for 5 days upon arrival and undertake 2 tests during that time. Children aged under 12 travelling with vaccinated adults or adults that are exempt from vaccination or travelling unaccompanied must isolate at home for 5 days upon arrival and undertake 2 tests. Children aged under 12 and who are travelling with unvaccinated adults must enter MIQ with their family. New Zealand will remain our only international gateway for the time being and provide an additional safety buffer, so a traveller from a high-risk country must stand down for 10 days before continuing on into the Cook Islands. The MIQ costs and more detailed information can be found on our website www.covid19.gov.ck. Group 3 will also be required to provide their immigration status. The entry requirements will be enforced at the border by immigration officials, and failure to comply with the border entry regulations will result in travellers being denied entry to the country at the border. 2 weeks ago, our nation reached a new milestone. 96% of our eligible population in the Cook Islands are now fully vaccinated, and 99% have had their first vaccine dose. Today, thanks to the New Zealand government, our third dose or the booster dose of the Pfizer vaccine arrives this afternoon. And from 8 a.m. tomorrow, Te Marae Ora staff will be rolling out the doses, as well as offering first and second doses to all who are eligible and now want to be vaccinated. The best weapons we have available to us in this battle has been our isolation and closed borders, and now mass vaccination. As a government, we have to deal with the whole population. And like every major government around the world, the course open to us has been to secure and administer doses of vaccines with proven efficacy like the Pfizer vaccine. It has been safely administered to hundreds of millions of people around the world with proven beneficial results and negligible serious negative results. To protect our people even more, we need to vaccinate our 5 to 11-year-olds as soon as the vaccine is cleared for that age group by MedSafe in New Zealand. Close to 30% of the people in New Zealand who are now sick with COVID-19 in this latest outbreak are children in that age group. Why should our people and children suffer when the overseas experience tells us that more than 90% of people vaccinated, particularly with Pfizer, either avoid the virus or don't suffer serious illness and death? The figures around the world show clearly that COVID-19 is overwhelmingly an illness of the unvaccinated. We have worked very, very hard in the last 2 years to maintain our COVID-free status. And these regulations and our continual drive to get our eligible people vaccinated is a continuation of that. Vaccination is the best protection we have against this pandemic. The fewer unvaccinated people we have, the fewer chances the virus has to spread. It is an illness for the unvaccinated. And even if vaccinated people are sometimes infected, they tend not to get seriously ill or require hospitalization, and they seldom die of the disease. To further contain and reduce the spread of this virus, we must learn to live with the new norms of public health. Face masks will be required on public transport, for workers in close proximity businesses, and required for entry into high-risk facilities. Wearing face masks is encouraged when in any public place. The Cook Safe tag-in will be mandatory for certain facilities and encouraged at all business and facilities. Indoor facilities that have poor ventilation, where activities such as singing takes place, pose a high risk. There are no capacity restrictions if the facility only allows vaccinated members and guests. But should the facility decide to allow unvaccinated members, then it must impose a 100-person limit. It must maintain a 1 meter physical distancing and require that face masks be worn. Children under 12 are exempted from this measure. The decision not to vaccinate remains your personal decision. However, unvaccinated frontline workers involved in health, teaching, and the borders will be subject to COVID-19 surveillance testing as required by TMO. All businesses and government agencies will be required to appoint a COVID-19 health and safety officer whom TMO will train to administer the new requirements. Moving to our Pāinua, and after consultations with the island governments, travel will be organised around 2 bubbles. Aitutaki is 1 bubble with Rarotonga, and travellers to Aitutaki must be vaccinated and undergo a rapid antigen test before departure. The other Pāinua are a separate bubble, and in addition to the above conditions, the traveller must stand down in Rarotonga for 7 days prior to travel. Note that the vaccination requirement does not apply to those resident in the Cook Islands prior to the 13th of January and have not left the Cook Islands. However, if despite our best efforts, COVID does get past our defences, we have made provisions to deal with any community transmission. New Zealand, like the Cook Islands, is aiming for the highest possible vaccination rates in order to limit community transmission, and the strategy is that the high vaccination rates, any illnesses will have mild symptoms, enabling people to be cared for at home and not overwhelm the hospital system. Consequently, because we expect that if we get cases, most will be mild and can be managed and cared for in their own homes, with oversight by public health nurses and healthcare assistants operating from the 5 health clinics in Rarotonga and supported by the 10 puna. In Aitutaki, a task force will provide support to mildly affected patients being cared for at home. Part of the service will be a healthcare pack issued to affected households with simple devices which an adult household member can use to check the patient's temperature, their pulse, and their oxygen level, and report these details to the public health nurse. On Rarotonga, moderate cases will be managed within a separate isolation facility staffed by doctors and nurses. On Aitutaki, the hospital will become the isolation facility for moderate cases. Any severe cases will get transferred to and managed in the specially set up Te Ko'u ward at Rarotonga Hospital. So you can see we have been giving this reopening and its consequences and how we might mitigate any downsides to opening a lot of thought and planning as best we can with the resources that we have. We can't hide from COVID forever. The best part of 2 years, we have stayed closed and stayed at home. But we are seeing now the costs of our people leaving and the costs to the country that has been very high. We are now ready to open for business. I'm pleased that we will provide this Christmas and New Year period an opportunity for our frontline staff to have a break before we reopen on the 13th of Jan. So enjoy your break while you can. Kia ora ana tātou e kia manuia.